Do you have questions about liposuction? You are not alone. Whether you're considering it for the first time or you're just curious, I get asked a lot of questions, and it's usually the same thing every week, from safety and results to recovery and myths. Let's clear the air. My name is Dr. Karan Shetty, and I'm here to answer the frequently asked questions I get about liposuction. So the first question is liposuction a weight loss procedure? This is a very common misconception. Liposuction is not a weight loss procedure. It is a body contouring procedure. It removes stubborn fat deposits that don't respond to diet and exercise, especially around the areas in the abdomen, flanks, thighs, arms, and under the chin. It is about reshaping and not shedding kilos. Am I a good candidate for liposuction? The best candidates are those who are in their ideal body weight but also have localized fat deposits and are resistant to lifestyle changes. You should be in good health, have realistic expectations, and understand that liposuction is not a substitute for healthy living. Another question I get asked: will the fat come back after liposuction? The fat cells that are removed do not come back, but that doesn't mean you will not put on weight. The fat cells that remain can always become bigger in size, and hence you can look like you have put on weight, which means the number of fat cells don't increase, but the fat cells that remain can always become bigger in size. So it's very important that you maintain your lifestyle, maintain your nutrition, which is important for long lasting results. The fourth question I get asked: is liposuction safe? Yes, it is very safe when it is performed by a qualified plastic surgeon. We used advanced techniques like power assisted liposuction, um, body tight radio frequency, and all these devices to, one, minimize the trauma associated with liposuction, and second, to shrink the skin and make it tighter and come back to a much firmer position after a liposuction. We follow very strict safety protocols. Our anesthesia is closely monitored, and I can say with confidence that liposuction is extremely safe when done by the right surgeon and in the right hospital. My fifth question: what is the recovery like? Most people return to light activity in a few days and work within a week. You'll have to wear a pressure garment to reduce the swelling and to reduce the and to support healing. This pressure garment is worn for a period of 1 to 2 months. Bruising, swelling, and mild discomfort are expected, but they are manageable with prescribed medications. Full results take about a month, month and a half to start becoming visible. Another question I get asked very commonly: will I have scars? Liposuction scars are usually very small, just a few millimeters, and they are placed in areas which are strategically placed in natural creases or in hidden areas. They typically fade significantly over a period of time and become barely noticeable. Another question I get asked: can liposuction tighten loose skin? See, this depends. Liposuction removes fat, but if your skin elasticity is great, it will bounce back to a very nice position. But if you have a lot of skin elasticity, we do use a machine called body tight, which is a radio frequency machine which tightens the skin. It's like using an iron on the skin. But in some cases, when the elasticity is too much, you have to recommend a skin tightening procedure where, just like a tummy tuck or an arm lift or a thigh lift, because the technologies are not amenable to a perfect tuck. How much fat can be, right? So another question which is very commonly asked: how much fat is removed safely? In general, we limit the amount of fat or the liposuction aspirate to about 7 to 10 liters. Usually, I do not like to go about 10 liters, which is probably the maximum. A safe range is around 6 to 8 liters. So it's not about removing as much fat as possible, but it is about sculpting strategically for a natural proportionate result. So understanding liposuction starts with the right questions. And I hope I have helped in clarifying some common concerns. If you're considering body contouring, always remember to talk to a board certified plastic surgeon who can guide you safely, ethically, with realistic outcomes. Liposuction is, though looks easy, is one of the more difficult procedures because it's a combination of art, technology, and skill. So go to someone. We are constantly learning, and go to someone who has done good number of procedures. I'm Dr. Karan Shetty. Thanks for watching. Drop your question in the comments and don't forget to check out our next video in this series. Thank you.